The 12th PAGB Annual Self-Care Conference, co-hosted by the Royal College of General Practitioners, the Royal College of Nursing and the National Association for Patient Participation, aimed to move the self-care debate forward. In previous years, it explored why self-care is important and why it should be promoted. This year, it was all about how to make it happen. This focus on practical ways to change behaviour among the public and health professionals was endorsed in person by Care Services Minister Paul Burstow.
I look forward to the challenge, and I think we do have a challenge if we are to make self-care a reality, because we know if we make it a reality, it is much, much better for our fellow citizens, and it also delivers the dividend of using the resources the taxpayer puts in to deliver the very best possible outcomes, and I hope that's what we all are here to achieve. Thank you very much.
Present in the room were delegates representing the entire spectrum of general practice, from GPs and nurses to pharmacists and patients. To kick-start the flow of ideas, a video message from NHS Confederation Chief Executive Mike Farrar gave a ringing endorsement of the self-care message, the conference itself, and Self-Care Week, which would follow.
I'm really sorry I can't be with you. I really look forward to the products of the day and indeed the momentum that we'll get from Self-Care Week. And I promise you that the NHS Confederation, which is a voice for the whole of industry, will look at the findings from your work today and the impact that you have next week, and we will build that into our future, the voice of the industry talking about how it deals with the challenges that lie ahead. And self-care will be centre stage in that voice.
Along with this top-level support came some practical advice from the keynote speaker, Denise Hampson, a former British women's track cycling champion. Her message was clear. If you want people to change, make the change desirable and make it easy. The patient group NAP then held the floor, as its chief executive shared the results of a self-care pilot, including some practical suggestions from patients.
Very simple ideas. A leaf that the receptionist gives to the patient. These are the questions you might want to ask the GP while you're here. These are the kinds of things you might want to tell your GP. Just think these through while you're waiting. What have you tried already? These are the things I've done. And when you've written down the answers, just keep that, take it home. And if the same thing crops up again, you'll have something to remind you.
Patients aren't the only group that need to change their behaviour. Delegates heard how health professionals should embrace the idea of their patients self-caring. The conference was the launchpad for a new online course called Supporting Self-Care for Minor Ailments, developed and accredited by the Royal College of GPs and funded by NHS North West.
How are we going to educate patients if we don't actually educate GPs themselves? And that's why we've been absolutely delighted to be part of this group, working with the college to actually come up with a CPD model.
This was just a huge opportunity to really hit a mass number of professionals, GPs, practice nurses, practice managers, with one programme going out simultaneously on a great day like today. This is our launch day today, and it's immediately available.
In the afternoon, the conference heard from representatives of 3 allies for change: local authorities, pharmacists and nurses.
I'm hoping in the future, and I think it'll be a few years off, that we actually provide an integrated approach. One of the problems has been that community care has been separate from hospitals. GPs have been separate from community care and hospitals. They're all separate silos who receive massive funding but don't work in a continuous pathway, and that's got to change.
It's about the primary care team working together across nurses, GPs and pharmacists, all adding value, because very often things need repeating. People only take in so much information, and the environments are different, and therefore people take different information in different environments.
What we haven't really built into nurse education is the psychology of behavioural change. So what I would wish for, that while we plan a new nursing programme, is that our future generation of nurses are really geared up to actually making every interaction with a patient or carer something around, this is what you can do to help feel better and be more healthy.
The rest of the day was dedicated to introducing the Self-Care Forum, which was set up earlier in 2011.
The forum is about bringing together all the groups, professionals and lay, who believe in this and who can influence the agenda. And it therefore has got a programme of work. It's not just a talking shop, it's a programme of work. And that's what's so important. It's about actually getting some information out there, some support out there, some products out there.
The conference ended with a lively discussion, fuelled by the new ideas, new projects and top-level support the delegates had heard about today.
It's taken us a while to get the professions to say that they needed to sign up to it. They felt that it was important. But now that we're hearing patients say the same, then I think we're actually going forward towards a dialogue between professional and patient, professional and the public that is an adult-to-adult conversation.